It is a year-round effort here, but this also happens to be National Lead Poisoning Prevention Week.
So let's welcome in the Onondaga County Health Commissioner, Dr. Katie Anderson, to talk about the issues and the methods of mitigating lead poisoning. Good to see you again. Thanks for being here.
Thanks for having me.
I think fairly, there's been a good deal of attention the past several months about issues of lead coming from water service lines in the city. We've talked about it before, but what is your level of concern there with that issue?
That's an area where we've been in close communication with the city for some time, and I'm happy to report that the faulty testing that was reported last year has since been corrected. All measures now are well within the limits set by the EPA. But that said, the risk of lead in water is not zero, although it's much less than the risk from lead in paint. When water sits in contact with lead service lines or lead pipes, some of the lead can leach into the water if it sits overnight or for 6 hours or so. The good news is homeowners who are concerned have a simple solution at their hands. They can just run the water till it's cold, pull in that fresh water from the water main, and then it's fully safe to drink. That's been shown in many cities across the country.
And Dr. Anderson, where is your biggest concern with lead poisoning?
That's an easy answer. That's lead paint. The reason we get so concerned about that is the majority of the homes here in Syracuse, over 90% of them, were built before 1978, which is the year that lead paint was banned. As lead paint ages, it can chip, it can crack, and it can flake off or create dust, which can easily expose young kids who are crawling around on the floor, getting dust or chips in their fingers, putting their fingers in their mouth, and they are particularly vulnerable to the effects of lead because their brains are growing so quickly, and it can have major downstream consequences for their learning, their behavior, and their health.
We've known about some of these issues, especially with the lead paint, for some years. How are we actually doing? Are we making any progress towards bringing down the cases of lead poisoning in our community?
So it is a long road ahead of us, but I'm happy to say on this first day of Lead Poisoning Prevention Week, we're making progress. So I'll point to a couple of things. At the county, we are very proud of the fact that we are increasingly getting to the source of the problem. So we play a big role in the health department with testing and diagnosing lead poisoning, but we really need to get into the homes and eliminate the hazard to begin with. So the county in the last 2 years has trained over 400 people to be lead-safe contractors, so increasing that workforce. And again, there's increasing grants available. We've just received the largest HUD grant in our history to renovate over 270 homes. So we're really starting to get in homes and support people to make their homes safer.
Well, let's talk more about what are the best ways and the best programs for people to reach out to you and get some help with getting lead out of their homes.
So at the county, across different departments and with community partners, there's really a comprehensive system here to support people and landowners, property owners, and families. You can always just call us up at the county. We're happy to answer any questions and help people navigate. If there are families who, multiple things they can do, make sure their kids are tested. They should be tested at ages 1 and 2. We can help make sure the tests are done. They can get their home inspected. If you live in a house built before 1978, call the health department and we can help link you up. And then again, there are all of these programs. Once a child is found to have lead poisoning, there's a system that's set into place with multiple steps. Testing, home inspections, linkages to care, and then linkages to grants and other supports that can help them get their home fixed up.
We're looking at the mobile van there. That still exists? That still goes around? Where do you catch that? Where does it show up?
Yes. So the mobile vehicle is a big part of our health department's priority to get out into the community and meet people where they're at and lower barriers of access to care. So we are routinely out in multiple areas across the county. We set up mobile testing events as well at churches, schools, other community centers. And again, this is a big part of how we want to show up and support people.
And yeah, I guess the big question is there's been so much attention on the city of Syracuse. How much of a problem is it outside of the city?
That's a great question. So the risk really ties into the burden of our aging housing infrastructure. And in our county, that's concentrated in the city. So again, 90% of our houses in the city were built before 1978, and that correlates with the risk of kids being lead poisoned. In the city, about 10% of our kids, unfortunately, are having elevated blood lead levels at ages 1 and 2. In other parts of the county, it's about 1%. So the risk is not zero, and again, that correlates with old houses. But the risk is there in Solvay and in Baldwinsville, and if you live in an older house, you should have lead at the front of your brain.
And the same programs and the same outreach, those exist no matter where you are. Again,
we
it's
are
not
the
just
county health department. We serve everybody.
Yeah. We appreciate you coming in and schooling us up on all this, and we'll continue. Like you said, it's a long road, but we got to start somewhere.
Right.
We'll make it
Thank you,
progress.
Dr. Anderson.
Appreciate it.